What is pain? So Dr. Ramdin, take it away, please.
Hi, good night, everybody. Thanks so much for your kind introduction, Anil and Dr. Seepaul. So the topic today is pain. What is pain? Put very simply, pain is a complex, universal human experience. And as we said before, it is the most common complaint that brings a patient to the doctor. It's also a huge burden to society, and is the number one reason for loss of productivity at the workplace internationally. So this is the official definition. This is taken from the International Association for Study of Pain. And you'll see there are many components of this definition. It is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage.
So Dr. Ramdin, for some reason, you've decided to show us two pictures, a gentleman's construction boot and a skull x-ray.
Right, so this is a little story I'd like to share to sort of illustrate that definition there a bit. So the guy with the boot here, these are true stories, by the way. This one was published in a medical journal in 1995. It was a 29-year-old construction worker who fell off a ladder onto this nail here. When he saw this nail in his boot, he was in excruciating pain, went directly to the A&E, and he got some very strong painkillers, opioids. To the surprise of everyone, when they removed the boot, the nail actually was between his toes. There was not even a scratch. But it was really baffling to know why it is he had all this pain. The other one there is a dental x-ray. This man, also a construction worker, very dangerous job like that, was using a nail gun. It discharged and clocked him in the face. Now, this man went around for another week working, and then all he had was a mild toothache, went to the dentist for an x-ray, then found that this nail was actually lodged and in his brain. He had absolutely no pain. So what this shows is that pain could be perceived in different ways. There is physical damage, but also it's a huge emotional component, right? And these are some keynotes that the association has also put forward to further describe what is pain. So I will just speak briefly about it. So pain is always personal, and it is influenced by several factors: patients' life experiences, what their concept of pain is. The pain that someone experiences and the biological process are two different things, which we could see in that last story there. Patients' report of pain should be respected, and pain is always what the patient says the pain is. The other thing is pain serves an adaptive role, and it may have adverse effects on the functioning and the quality of life of the person affected. And like verbal description is just one way to express pain. Pain could be expressed in many different ways.
But pain is the most common symptom that patients will present to a doctor with. And in terms of pain, are there different types of pain? Is all pain the same?
No, so pain could be classified in several ways based on duration. So acute or chronic, I'll elaborate on that a little bit more in a bit. Based on location, so that's a bit self-explanatory. So for example, headaches will be pain in the head based on intensity, whether it's mild, moderate, severe, and based on etiology. Etiology has to do with what the cause of the pain is. For example, if there is a lesion or damage to the nerves of the nervous system, then that is called neuropathic pain. Right, so just a little bit about pain in terms of duration. So there's acute pain and chronic pain. So acute pain is a pain that happens usually under 3 months duration, and chronic is when it extends beyond this time. There is another type somewhere in between both of them, usually between 4 to 12 weeks, called subacute pain. And the reason I want to talk about this is that acute pain, if not treated early, or if persistent, will almost always lead to chronic pain. So it's very important to treat acute pain at the time it presents. So acute pain relates to pain occurring during the time of tissue damage. So some examples will be during sudden illness. For example, a patient who has severe abdominal pain and later is found out to have appendicitis, patients who have pain during surgery, trauma, or have burns. And these are the types of pain that usually improves with tissue healing and relatively quickly. Chronic pain, on the other hand, is a persistent pain which continues after the intended time of healing or continues to be an ongoing process. And this is actually the more frequent presentation of patients at pain clinics. And these include spinal pain. So we'll talk a little more about this back pain in a bit. Post-traumatic pain, so pain after patients have had surgeries, amputations, pain involving the central or peripheral nervous system. So pain after stroke, for example, and those with other diseases, for example, chest pain due to angina or heart problems, arthritis, headaches, and then cancer pain, which is a huge topic by itself. Pain